Did you guys know that 73.5 million adults in the U.S. have high LDL, low density lipoprotein bad cholesterol? Well, high cholesterol affects many young adults, but especially the ones entering college as well because of their eating and exercising habits. Having high cholesterol means that people are twice the risk for having heart disease. Now, you guys will be able to benefit learning what cholesterol is all about, why it's so bad, and how to prevent it. According to CDC, Centers for Disease Control and Prevention, less than 48.1 of adults with high LDL cholesterol are getting treatment to lower their levels. Now, many people don't understand what high cholesterol is really about or how it can really take a toll on somebody's body and keep it to in a negative perspective. So the problem is that high cholesterol is starting to develop mainly among college students and, of course, throughout older adults. Now, having high cholesterol at a young age is terrible because it raises the chances of one being so young getting a heart attack or stroke before the age of 30. Now, here's like a presentation of what cholesterol really is. Cholesterol is a fat or lipid that is developed in your blood and it's in your arteries and it goes out and it's called plaque. Now, arteries are the blood vessels that carry blood away from the heart. And then here's a diagram of what cholesterol does to your arteries. The first picture is what it's supposed to do, like your blood is supposed to flow perfectly in your arteries, like no clogs or anything. The second one shows how bad cholesterol affects your arteries and how you see how your arteries start to get narrow and then like your blood does not flow easily throughout them. Well, that causes strokes and heart attacks. Now, there's two types of cholesterol, the LDL and the HDL. The LDL is the bad cholesterol, which that raises the risk of you having high cholesterol. Maybe raises the risk of you having a heart attack or stroke. HDL is the good cholesterol, which lowers the risk of you having a heart attack or stroke or heart disease. Triglycerides also is an important part of cholesterol because these are formed in which most fat exits in the food and the body. High triglycerides means that it's a high risk of coronary artery disease. And then these are like the ranges of where your cholesterol should stand. Your total cholesterol should be between 100 and 169. Triglycerides should be between 0 to 89. HDL would be more than 39. And LDL should be 0 to 109. Now, I'm an example of a college student that has high cholesterol. And then to give you like a broad range of like what my cholesterol is focused on and why it's so high. So my total cholesterol is at 229, so that's off the charts. My triglycerides were at 131, so that's obviously higher than where it's supposed to be. My HDL was good, it was at 80. It's a little high, but I mean it's good cholesterol, so they weren't too worried about that. And then my LDL was at 123, which is my bad cholesterol, so that's why they were very concerned because all of those numbers were dropped super high. And for me being only 19, they were concerned for that. And I got high cholesterol last year because of the fact that it runs in my family, but just because it runs in my family doesn't mean I'm going to get it. But the fact that I wasn't exercising or eating healthy when I entered college is one of the factors that caused me to have high cholesterol. For example, in high school, I wouldn't eat dinner past 7 p.m. In college, I started eating dinner at like 11 p.m. I started getting munchies at like 2 a.m. and I wasn't eating healthy. And then also exercising. I would only exercise in college probably like twice a month, which is nothing compared to what I did in high school. So those factors take a big toll into what you're doing, into getting high cholesterol. Now, according to the World Health Organization, raised cholesterol is estimated to cause 2.6 million deaths. Now, CDC states that the only percentage of American adults with high LDL cholesterol has dropped to 2% since 2000. Now, that is basically nothing. It should be dropping a lot more than that. And the Daily Free Press states that college students may think they are immune to such problems, but 9.5 of men and 10.3% of women are aged 20 to 34 have high cholesterol. Now there's like a wide variety of you guys here, and you guys range from 20 years old to 50 years old. But I know most of you guys can relate to at some point in your life, like slacking off with your health and slacking off with exercising. But a lot of you guys are very young, and you guys really don't want to deal with this problem at all. Having high cholesterol is nothing to be happy about, but it doesn't mean it's the end of the world because there's so many things one can do to control cholesterol and maybe even get it back to normal. Some solutions are a large-scale solution would be an educational campaign where you guys can talk about how effective you can like train to control your cholesterol and how you guys can connect as one another as you guys talk about your cholesterol. And besides, by containing, you will have a higher chance of grasping it on your attention. And we're providing a continuing students to learn more about the topic and learn how to control yourself from getting heart attack or stroke. And now a personal solution, exercise and maintaining a well-balanced diet is the way to go to control the high cholesterol. According to the WebMD and Pridgen, they provide several things to do to reduce your cholesterol. The first thing is to limit your intake of foods full of saturated fats and trans fats. And you also want to eat a lot more fiber-rich foods such as beans, oats, your fruits and vegetables. And to choose protein-rich plant foods over meat. You don't want to have a lot of red meat like sausages or salami, and you want to have like chicken, but not fried chicken. You want to have grilled chicken. And if you want to eat seafood, it has to be like healthy fish like salmon and tuna. And you want to lose any excess weight as possible by exercising at least 5 times a week. Not, that doesn't mean you have to do like 10 times a week. You have to actually eat at least 30 minutes a day. And here's just some examples. Again, you have to exercise 30 minutes a day, your fruits and vegetables, beans, and these are things you don't want to do. You don't want to eat. You don't want to sit around on the couch watching TV. You want to get out and run, go for a jog in the morning. If you want to walk to your mailbox, walk to your mailbox, don't drive to your mailbox. And don't eat donuts, don't eat popcorn, don't eat fried chicken. And, all right, so I want all of you guys to close your eyes and just imagine this. Imagine your doctor telling you you have high cholesterol. Now, the first thing you would do is you want to take control of your intake and fatty foods and just start to exercise. You wouldn't have to be constantly getting blood work or checkups, and you will be positive. Doing this will have a positive impact in your mood because you'll be healthier. Eating habits and exercising will just change your mood and like how you won't be as tired again. Now, on the other hand, imagine if you found out you have high cholesterol and you don't take any immediate action. You will start to feel very tired, less energetic, you will run out of breath, and you will feel lightheaded, and days will just be miserable for you. It can get really bad to the point that your arm will start to feel numb, and if that's the case, then that means your cholesterol is very high, and you will have to take immediate medical attention. Now, taking control of your fat intake and maintaining a balanced diet and exercising daily will help prevent and control the risk of developing high cholesterol. So now in conclusion, high cholesterol leads young adults to a high risk of getting a heart attack or stroke. But it all depends on how you take your fat intake and how much you develop. And high cholesterol is starting to develop a lot more nowadays in college students because they're getting so involved in schoolwork and just very concerned with their GPA. So remember, do you want to live a long, healthy, fun life, or do you want to live a short, sluggish life where you feel tired?
Healthy fun life.